Hello, thank you for joining this short webinar on primary care workforce development. Novo Nordisk has provided sponsorship to Leicester Diabetes Centre, Eden team to deliver a workforce development webinar and accompanying workforce development materials, best practice examples and do-it tools. Novo Nordisk has had no influence over the webinar agenda, arrangements or any accompanying materials. We plan to look at why this is such a pertinent area of focus now, and to consider what we mean by primary care workforce development. We're going to share how Eden at Leicester Diabetes Centre have approached this in partnership with primary care and share some of our findings as well as our drive and passion for improvements for people living with diabetes. In a moment, we'll talk about the challenge for diabetes services and what the need is, and then move on to think about what we have done to meet the need by using a triple case study. Reception staff and patient services are the first point of contact, yet often receive no structured training or education. A systematic review looked at this group of staff taking on previously more clinically orientated roles with suitable training. Social prescribers and link workers are described as the eyes and ears of PCNs, and they're essential for continuity of both health and social care in general practice. Healthcare assistants are described on the NHS Careers website as changing lives every day and at the very heart of healthcare. And we're going to share some best practice examples using these three key roles before concluding and closing. The NHS workforce then is in crisis. And whatever you read, the headlines are similar. You know the headlines because they're ever so familiar to us. And many people are living the reality of the headlines. And the narrative describes your current reality to a greater or lesser degree. Everybody knows what GPs and practice nurses can do and do every day, day in, day out. And hopefully people have known for a number of years about the role that pharmacists can take in primary care, which is part of another Eden success story. However, there's increasing numbers of people being diagnosed with diabetes. Those with diabetes have been struggling even more with their condition during the pandemic, rising HbA1cs, effects on weight, effects on mental health, as well as other physical conditions. Changing ways of working due to COVID, increase in phone calls, increase in necessity of face-to-face has all added to the demands on primary care. And changing workforce structures with many people leaving the profession, either through retirement or just leaving, has left greater demands than ever on primary care. So is there any good news? Well, where and who else in your primary care workforce, either current or proposed, can support the delivery of excellence in diabetes care? How can we ensure that people living with diabetes receive the right care at the right time, in the right place, every time, with the right information, making every contact count? Whether it's NHS providers, the King's Fund, the British Medical Association, or other bodies, all agree that staffing is the make or break situation in the NHS at the moment, and that workforce shortages have a huge impact both on patient experience and staff experience. Universally, they say that the only way forward is to move towards a new model in primary care, a new model in general practice, where an expanded multidisciplinary team exists that can draw on the skills of a range of healthcare professionals and support roles. How can the NHS then make full use of its capabilities and of its potential of the people? All agree again that primary care is the ideal environment for workforce redesign to take place. So what is Eden and where do we fit into this picture of primary care workforce development? Well, Eden is at Leicester Diabetes Centre in the heart of the NHS. And quite simply, education is our passion and has been for the last 9 years or more. And integral to that passion are a number of roles that we believe can support, that are the pillars, that are the foundations, the essential roles in primary care, core care, and these are the support staff in general practice. We all come to work to do the best job that we can. We go above and beyond every single day. And the question that we would like to ask now is, what other roles are there, can there be, and will there be, that will both support and lighten the load, the burden in primary care? Who can help with workforce demands? And where we're going next is to take a look at some of the work that we have done at Eden, our experience, our research, and our findings.
Okay, so we'd like to introduce you now to Eden Essentials. a diabetes training package with resources for a range of allied clinical and non-clinical but patient-facing staff. To view the different elements of Eden Essentials, all you have to do is go to the Eden Diabetes website and go to the Eden Essentials blog. And we'll be doing that in just a moment to show you how to access these resources. So we'd like to take you through some of our recently developed training resources and training packages, and then we'll look at the roles that they would be most appropriate for. So this is the foundation module, and it's suitable for absolutely anybody. It's a recorded lesson that lasts just under an hour, but it can be delivered as a live webinar if people prefer that. So it provides, as the name suggests, that vitally important foundation, ensuring that all new learners or refreshers grasp the concept of diabetes, and that it's not just about sugar levels, but it looks upon diabetes as a vascular disease, and it explores its connections to heart and kidney disease. It gives the encouraging message that we can work together to prevent adverse outcomes for our patients and give them a better quality of life. So shall we just go to a short clip from this foundation lesson so that you can see how it's presented?
So how can we have an effect on this health crisis? We need to do something, don't we? Can anything come to the rescue? What will reduce the numbers of people living with type 2? And for those who already have type 2 diabetes, what will reduce their risk of experiencing the possible complications that we've just looked at? Improving any of the risk factors, i.e. losing weight, increasing activity, lowering blood pressure and cholesterol, will help prevent diabetes. But for people already living with diabetes, improving these same things will help to minimize the risk of complications. So the cardiovascular, kidney, eye, and foot disease that we've just looked at. In cases where these complications have already begun, good management of these risk factors will slow or even halt the disease progression. And this is potentially life-saving news. So let's think about how we effectively help people living with diabetes to live a longer and better life.
So in addition to that, there is Eden Essentials Plus, and that's an additional webinar created specifically for healthcare assistants. It's a 2-hour live webinar, and it looks at all the elements of the diabetes annual review. And then it majors in particular on blood pressure and foot care. So made specifically for healthcare assistants, but also might be very appropriate to practice nurses as well. And that's Essentials Plus. And then we'll move on to look at the toolkit. So our newly developed toolkit is so useful. It's information on any diabetes or healthy lifestyle related topic, and it's readily available in one place. No internet searching, no unreliable or false information, and no time wasting, and that's so important. So let's take a look at the Eden Essentials Toolkit. Okay, so here you can see a list from A to Z of many, many different topics to do with diabetes and general healthy lifestyle. Anything that might be relevant to the person living with diabetes, and helpful information to all healthcare professionals. So if we can have a little look down, how about stopping on communication? Let's have a look. So all you need to do is click on the little link below, and that will take you to the Language Matters document, a fantastic document full of very simple and clear consultation advice, really, how to speak respectfully to your patients and without judgment, and just really clear, lovely advice all there. Let's see what else is in the toolkit. We'll have a little scroll down. We've got diabetes technology information, things to do with measuring blood glucose levels during illness, insulin information, what to do about low glucose levels, physical activity for people with diabetes, preventing type 2 diabetes, type 1 education. Let's click on weight reduction and see what's in there. So this one takes you through to the NHS website. Loads of free information for your patients there. There's a 12-week diet plan, which is really excellent. Meal apps, all good free information for your patients. That's just a small example of how to use the toolkit. There's loads of information on there, and we know that every link we go to will give reliable information. So we developed this originally for social prescribers, but the reaction to it has been absolutely staggering. Our GP partners love it, and basically everybody in the practice has been using it and found it just really useful. Saves a lot of time as well. So that's the toolkit. And now we'll have a look at Eden Elect. And this is something we are so proud of at the Leicester Diabetes Centre. This is a complete diabetes learning resource. All that the healthcare professional needs to know about diabetes and related health topics can be easily and quickly accessed in one place. It's quick and simple to use, but it contains massive amounts of information. So recently produced, it's full of up-to-date and reliable essential info. Shall we take a look at it now and just go briefly over how to use it? It's very simple. So here you can see the body, and each body part that you can see is you're able to click on. Any part of it at all. For example, we'll go to the brain. There's two sides of the brain. So one side of the brain is about stroke. You'll see 4 bullet points when you go into each side. The other side of the brain is about mental health and dementia. Again, 4 bullet points there. The 4 bullet points in each section give you the absolute essentials, that vital information that everybody needs to know. And then if you want to learn more about a certain subject, then just click Learn More. And then there's a lot more detail. You get the 4 main points again and more information. It contains guidance, recommended therapies, advice. All the nice guidelines are in there when appropriate, and lots and lots more reading for you. So as we said, you can click on any part of the body. So all the body parts, liver, kidneys, heart. If you click on the blood vessels, you'll get information about blood pressure and cholesterol levels, blood glucose levels. Should we click on blood pressure? There we are. So blood pressure care is absolutely vitally important for people living with diabetes. So there's all the statistics and information, what to aim for and what treatments to use. So if you click on Learn More, you can see all of that information there. Nice guidelines, what therapies to initiate people on, and then where to go, step 2, step 3. So fantastic information on absolutely anything, all in one place. It can be used as a decision-making tool for yourself, or it can be used with your patients if you're in a face-to-face consultation. We're using it also as a teaching aid, and it's going to be the basis for live and highly interactive educational sessions. So the sessions are completely bespoke to each group or audience as they choose the topics most relevant to them. So you may get a group where lifestyle intervention is their main focus, and they might want to focus mainly on smoking, alcohol, diet, and exercise. And then maybe a more medic focused group might want to look at the liver or kidneys, cholesterol, etc. So a completely bespoke educational resource and used for a very interactive session where people can just ask questions about any particular aspect that they want. So that's Eden Elect. Lastly, on the resources, we'll take a look at this infographic guide. So this infographic was specifically developed originally for reception staff, but it has been loved by, again, everybody in the practice. Healthcare assistants have taken to it as well. So it helps reception staff to direct patients with diabetes to the right healthcare professional in the most appropriate time frame. When we spoke to reception staff about their needs, this is what they asked for. So let's have a closer look at this. So in red, there's a list of circumstances requiring urgent medical attention immediately. In amber, patients who need to be seen as soon as possible or within 1 week at least. And in green, ideally within the next month or in line with their review date. And then at the bottom of the infographic, there's a little purple section, which is a reminder of the 4 T's. And that's a must for everybody to know about. So this simple guide has the potential to prevent hospital admissions and even deaths. It enables receptionists to do work more quickly with less stress. And a lot of the receptionists that have used this resource have said how much it's reduced their anxiety. They used to wonder a lot if they'd done the right thing, and this gave them a lot of reassurance. So this slide just sets out clearly what resources are available and to which role they would be most appropriate. So the Foundation Diabetes lesson, as we can see, is appropriate for everybody, suitable for all. The Eden Essentials Plus webinar was developed mainly for healthcare assistants, but again, other people like practice nurses, it may be appropriate for too. The Assisting People with Diabetes infographic was developed mainly for reception staff, but again, anyone in the practice may find that useful. The Eden Elect live webinar could be appropriate for social prescribers and link workers and healthcare assistants. And then the Diabetes Toolkit is appropriate for everybody. And we feel everyone in the practice will probably find that really useful. So there's just an outline of what we've got. So let's look at each individual role that we looked into for this project. So receptionists first. I have to say it's been an absolute joy to connect with this often forgotten group. Their enthusiasm and thirst for knowledge really shocked me. Receptionists are the focal point of the practice, the first point of contact, and they act as a buffer between patient and healthcare professional. And we all appreciate what a complex and difficult job they have. They are by no means just administrators. Their role has clinical elements too. For example, passing on of results, prescription requests and queries, repeat prescribing, and a degree of triage when booking appointments. Dealing directly with often quite emotional patients, COVID has added to the demands of this role. And the role of the receptionist has been expanding, like all roles. Many also take blood pressures and blood tests, do heights and weights, etc. So receptionists are essential to the smooth running of primary care. And they too have training needs that I feel we often overlook, concentrating on training needs of clinicians so that they get their CPD hours. It is easy to overlook this group. And it's been a delight to see how welcomed our training has been amongst reception staff. They all wanted all we could give them, saying anything you can give us will help us. We need to know more about diabetes. It definitely helped them feel valued and worth investing in, as well as improving patient outcomes and experiences. So we'll have a look now at our best practice example of receptionists. So our inspiration for developing resources for receptionists came from this event. So this is my friend's son, who is called Jake, and this was an event that happened 2 years ago, and he is registered at a university practice in Leicester. So Jake was a university student at the time. He felt unwell for several days, and he'd phoned the surgery asking for an appointment. So the receptionist, Susan, asked him to briefly describe his symptoms. Jake informed her that he felt really ill and tired. And the receptionist then asked him if he was thirsty or if he was going to the toilet more and if he'd lost weight. And when he answered yes, she asked him if he could get someone to bring him to the surgery with a urine sample as soon as possible. He did so, and he was referred to the diabetes specialist nurse within the hour. Jake said that he and his parents have been so grateful to Susan for taking prompt action, rightly suspecting that he had developed type 1 diabetes. And this story gave us the inspiration to develop diabetes training and the appropriate resources for all receptionists. There could have been a very different ending to this story had Susan not been aware of the symptoms of type 1 diabetes and the possible consequences. Okay, so social prescribers or link workers. In case anyone isn't sure exactly what these are, social prescribing is a way for local agencies to refer people to a link worker. So NHS England says they give people time, focusing on what matters to them and taking a holistic approach to people's health and well-being. They connect people to the appropriate group or organisation for practical or emotional support. They often work with people with one or more long-term conditions and create a personal plan for them. They sound just what we need, don't they? So they work with patients, they connect with them, and they give people time focusing on what matters to them. I mean, they sound amazing. There may still be some hesitancy surrounding the value of social prescribing. If we can embed them into the multidisciplinary primary care team, training and supporting them, what they will add will no doubt improve the health and well-being and quality of life for people living with diabetes. Let's just have a look at a best practice example from the social prescribers. So one key best practice example was from a social prescriber and link worker who was supporting an individual with type 2 diabetes. His name was Ken. The social prescriber asked Ken how things are at the moment and if he had any concerns. Ken mentioned that he had previously suffered with a foot ulcer, which was now healed. He always wanted to know how he can best look after his feet and reduce the risk of another ulcer occurring. But he didn't feel that he could ask his GP or practice nurse, as they had many other things to discuss with him. So the social prescriber then accessed Eden Essentials Toolkit and clicked on the Foot Care tab, which then brought up key information from Diabetes UK about good foot care. So Ken and the social prescriber then read through and discussed the information. And Ken was really thankful for the information. And he stated that he now feels better prepared to provide self-foot care, which is essential to preventing foot injury or ulceration. In some circumstances, foot problems can result in hospital admission, amputation, or even death. And he just felt that this had been the answer to all his questions. And he felt very satisfied with his consultation with the social prescriber. And lastly, but by no means least, are the healthcare assistants. So what on earth would we do without this group of people? I dread to think, really. So they do so much already, but as is usually the case, we continue to add more and more to their role. And we do need to be careful not to overload them or take them for granted. But we've seen how healthcare assistants really blossom and flourish because we've invested time, supported them with education and relevant training, and given them the background to the work we ask them to do, that all important knowledge of why we ask them to do these things and why they're doing it. Many have said, oh, now I know why you asked me to do this. And it's made their workload more enjoyable. They've had renewed enthusiasm and vigor for their job. And patients feel comfortable speaking to a healthcare assistant. They like to chat to them, and they ask them things that they probably wouldn't ask their GP or practice nurse. And so they're such valuable assets to the practice. Patients will freely talk to healthcare assistants about their diet and probably be a lot more honest, smoking, anything really. And so there's a shift in primary care. Healthcare assistants are now doing what we as practice nurses did 20 or 30 years ago. They are doing everything. And we do need to equip them, take care of them, nurture them, and make sure that they have the time to do what we're asking them to do. But we've seen them absolutely flourish when we've done that. Let me give you an example. So Eden has trained many, probably hundreds of healthcare assistants over the last few years. And the areas we've covered are Leicester and Leicestershire, Herts, Valleys, Manchester, Lincolnshire and Lancashire. I'll give you an example of healthcare assistant training that we did in Manchester CCG in 2019. We worked together with the University of Manchester NHS CoDes team to ensure that the content was appropriate and all-encompassing. We successfully delivered the previously discussed diabetes training. So feedback from the CCG and the delegates was overwhelmingly positive. And I'll read you this quote from Nicola Milne. We have really enjoyed working with Eden. Thank you for putting together such a comprehensive diabetes training program for healthcare assistants. The feedback from them illustrates the great value that the attendees have placed on the education. And some feedback then from practice managers who have these healthcare assistants in their practice. We realise that we have a special group of healthcare assistants who are highly skilled and capable following training. They can be relied upon to carry out all the necessary checks for patients with diabetes. This has been so beneficial, not only to the running of the practice, the patients are happy too. So great outcomes there.
So drawing this webinar to a close, we hope that we've shared with you why it's such an important area and what we have developed at Eden and how we've implemented the solutions into the complexity, into the busyness of primary care worlds across the country. Most importantly, what we've shared is what people say about these resources, those who use them and are trained in them, those who benefit from those who use them, and those whose roles are supported and made easier by the skill enhancement of their colleagues. If we link back to some of the previous documents that I mentioned, so the Primary Care Network document that was published in 2021, where the creation of diabetes support teams, the DIAST teams, were mentioned, they describe as essential the appropriately educated and upskilled workforce in diabetes management for the future. The Topol review talks about the need for frontline staff to have new skills, to be able to adapt to new ways of working, to blur boundaries across health and social care as we move forward in an ever-changing world. For us, it's about ensuring that the next wave of these and other developing roles in primary care have both the capacity and the capability to become integrated into this expanded MDT. We've shared some examples and some resources now and expanded ways of working that we have used to support improved outcomes of people living with diabetes and those with long-term conditions, ensuring that at Eden at Leicester Diabetes Centre, we play our part in making every contact count.